Welcome, everyone, and thank you for joining us. My name is Jennifer Larson, and we're just going to go through some quick housekeeping reminders while people are joining. We are recording today's session, so please avoid sharing protected or private health information. We will also be managing questions in the Q&A panel, so please type those in as you have them. The chat panel will be used to only share links or additional information with you throughout the presentation. So we will not be addressing any questions in the chat. We will post these slides and the recording on our website in the coming days, and we'll put that link in the chat for you. And if you're listening by phone, you can still participate by pressing *6 to unmute or *9 to raise your hand. And if you need closed captioning, you can click the CC button at the bottom of your screen to either turn that on or off. On our next slide is our mission, just to remind us that we are here to improve healthcare equity, access, and outcomes for the people we serve while saving Coloradans money on healthcare and driving value for Colorado. And now I will turn it over to Bonnie to start the presentation.
Hey, good afternoon, everyone. Thank you so much for spending your afternoon here with us and many of my colleagues from the Office of Community Living. For those of you that I haven't had the opportunity to meet, my name is Bonnie Silva, and I serve as the Director of the Office of Community Living here at Healthcare Policy and Financing. Jen, if we can go to the next slide, I want to ground our discussion today in the purpose of this particular engagement. It really is intended to be informational sharing. We have a lot of work happening specifically around long-term services and supports. And recently we have had to pivot on our implementation plans for many of our strategies, for many of our key priorities, and so we have committed to provide this space to provide ongoing updates on the status of our key priorities, on the pivots that we've made, and that should you have a desire to more deeply engage on any buckets of these work, to make sure you understand how you can plug in and do that. If we can go to the next slide, please. Our shared goals for this work, our key priorities, and really across the work of the Office of Community Living is first and foremost to continue the efforts to stabilize our system and make sure that it gets back to the place where it is fully operational in a way that we all expected and need, and really is well positioned to achieve, I think, the vision that many of us have collaborated on for what the future of long-term care looks like in Colorado. Our goal is to make sure not only that people have access to services, but they have expanded access to services. We have prioritized key strategies that help us make sure that, especially in this environment, that help us to save money and that are fiscally sound. And to that end, as we have crafted our pivots, we've worked with stakeholders to really look at how we can reduce any administrative burden for our contractors or for our provider organizations to really ease the effort of implementation to the extent possible. And then certainly last but not least is compliance. So you can see that we have prioritized work that is necessary for either compliance with state statute, federal statute, or perhaps the Center for Medicare and Medicaid Services requirements. So with that in mind, these are the goals that we're trying to achieve as we talk about the work that is underway. If we can go to the next slide, please. So the priority projects that we will cover today, this is the same as the last two webinars that we've had. And you'll notice that there is some color coding here. And really, the intention of that isn't just to have a fancy slide that is more appealing than our typical black and white efforts, if you will, but to sort of highlight that while this feels like a lot of projects, and it is to some extent, many of them are contingent upon one another. And so they kind of hang together. Like you can't do one without the other in a meaningful and efficient way. So I think at the foundation of all of this work is our efforts to stabilize our long-term care system, which is certainly broader than the Office of Community Living. But that work impacts the people who are served by this office, and so it impacts, of course, many of our initiatives very specifically. Then you can see in the purple we have prioritized community first choice that helps us achieve that goal of saving money and expanding services. But in order to make sure that people maintain access to services, we need to merge the children. We need to create the children with complex health needs waiver by merging the CHCBS waiver and the children with life-limiting illness waiver into one. So that is an eligibility requirement for us to successfully implement community first choice. And so, to do that, we were really looking at the care and case management system implementation. And again, I think that's also another foundational one. You can also see that we have come up with a pivot for, how to implement the Colorado Single Assessment and Person-Centered Support Plan, and how we will decommission the use of the supports intensity scale. So those two things kind of hang together in our plan there. And then you can see that we have the Skilled Nurse Assessor, which is a new initiative underway, really designed to holistically help people understand all of their options for nursing services that we have slated to be implemented at the same time that we are resuming pediatric long-term home health prior authorization requests as part of meeting our federal requirements to ensure that we have good line of sight on the programs that we're administering. And then, of course, we have efforts around nursing facility transition and diversion efforts. Again, those really help us to fulfill the promise of Olmsted and make sure that every Coloradan with disabilities has the option to live in the community if that is their choice. And as I mentioned previously, the IT system that we have operationalizing all of this really is key to our long-term success in many ways. I think as you will hear from my colleagues, we have many workarounds or pivots away from that system to allow us to more efficiently implement this work while we're working to make sure that care and case management system is in alignment with what we need it to be fully operational. So we can go to the next slide, please. So again, the foundation of all this efforts, the reason why we have pivots is that, we had the convergence of issues that I think we can all agree disproportionately impacted the long-term care community. And that was, the end of the PHE unwind, the implementation of our federally required conflict-free case management requirements, and also the implementation of a new IT system. All those things happened at once in a way that had certainly some unintended consequences for the people who receive LTSS, their families, the advocacy community, and the provider community. So we continue to look at our 5 key strategies. If we can go to the next slide, that we put in place to really make sure that first and foremost that members continue to have coverage and that they have access to care. That is our top priority. And you can kind of see the cascading strategies really help to support that priority outcome of making sure that people continue to have access to services. So obviously we need to make sure providers are receiving timely payment. That is key. So we have several work streams related to that effort. Having a functional IT system, as we talked about, is really important to administer, making sure that we are relieving any administrative burden on our case management and county partners. That then lends really well to reducing the county and case management backlog efforts that we have worked in partnership with our local communities to put in place and to remediate those backlogs. And then also making sure that in the event that somebody does lose services, that they fully understand their appeal rights, that they are leveraging those, and that we make sure that we have our escalations team at a state level to provide support to our county and case management partners to really look at individual cases and make sure that, if there's individual problems for us to fix, that we are working hand in hand for that. We are not going to talk about all of the work streams underway related to stabilization within the constructs of this webinar. As I sort of gave a nod to, that work spans all of healthcare policy and financing. And today, this webinar really is specific to the key priorities within the Office of Community Living. We do have a stabilization website. If I can ask somebody from my team to maybe drop that in the chat. So if you're interested in understanding more about those efforts or need access to our escalations form, that is the place to go. And if we can go to the next slide, please. All right, and so now I'm going to hand it over to Lana Eggers. Lana is a section manager within the Office of Community Living, and she and her team are leading up our efforts to implement Community First Choice, and she's going to give an update on our plans for implementation and the pivots that we've made and our status around that. So here's to you, Lana.
Great. Thank you so much, Bonnie. Good afternoon, everyone. As Bonnie mentioned, I manage our Waiver Innovation and Compliance Unit, or section at the department, are responsible for the implementation of Community First Choice and the oversight of our 1915C waivers. So first, I'll talk about Community First Choice. Community First Choice, which I will refer to as CFC, expands access to home and community-based services. Members on both waivers and the state plan will have access to more services, service delivery options, and it will help members move to or stay in the community. CFC also allows the state to maximize federal match for the cost of service. It brings in an additional 6% match on our service costs under Community First Choice, helping to supplement the service costs that we are outputting. Next slide, please. So our goal is to implement Community First Choice by July 1st, 2025. So we are just under 4 months out, really, really close to getting this great program off the ground. Services on CFC will be available to a member who needs them. So it's different from the way that our waivers function, where a member would have to meet a specific targeting criteria and then be enrolled in a specific waiver in order to access the services that are on that waiver. Under Community First Choice, when we move these services over to the state plan or basic Medicaid, as you might know it, that means that any individual who has an assessed need for one of these services can access it. So it will expand access and really get the services to folks who need them. CFC expands our options for consumer-directed services. So it expands consumer-directed attendant support services and our in-home support services service delivery models. That means that members or guardians can have more control and more say over the services that a member needs. It expands both of these service delivery options to children, which we're really excited about. Historically, there have been some restrictions on who can access these, so we're seeing some benefit there. And then lastly, CFC allows legally responsible persons to provide personal care, homemaker, and health maintenance. This is different from our current policy, which has some restrictions on legally responsible persons providing care to their loved ones. So this expands access, especially we'll see some expanded access to children here. Next slide, please. So a few updates on CFC. We are moving and grooving. We just received approval last month for our 1915K state plan amendment from the Centers for Medicare and Medicaid Service. This is a really important step towards the implementation of CFC as it grants us the federal authority for Community First Choice. Without this, we would not be able to implement the program. So receiving this approval is tremendous. We are also updating regulations for CFC. As I spoke about last month, we have heard from many stakeholders, and thank you so much for the updates. We have updated versions of those rules posted on our website. If somebody would like to provide additional comment, would be happy to take those. We are intending to go to Medical Services Board on April 11th for initial approval of those rule sets. The department has expanded and extended the licensure grant program for program approved service agencies. So you may remember that under Community First Choice, we have to align licensure requirements for providers. This means that some providers who currently provide personal care may need to obtain a license. We have a grant program that we're working with the Department of Public Health and Environment to support providers in obtaining those grants and obtaining that licensure. We'll have that link dropped in the chat there if you'd like some more information on that program. And then we're working closely with our vendors, Gainwell Technology and AssureCare, to complete the necessary system updates to launch Community First Choice. Next slide, please. We have case manager training beginning in March. We also have a lot of information that will be coming to case managers soon. We'll have a communication toolkit for case managers and some additional pamphlets and information that will help explain service options to members. We will have updates for provider-focused material, billing updates, provider bulletins, operational memos. Those are all forthcoming and should be released in the next month or two. We also have a CFC website that we put a lot of information on. So if you'd like to learn more about CFC, I would recommend hopping on that website and seeing if you can get your questions answered there, seeing if you could learn a little bit more about how this will change the services that you receive or the services that you provide. There are things like fact sheets and waiver charts that might be helpful to explain the impact of CFC. And then lastly, we have a Community First Choice Council meeting every month, and all are welcome to join. If you are interested in learning more about CFC, please join us for those council meetings. Next slide, please. Here is a broad overview of some of the high-level steps in implementing CFC. I won't go through this slide in its entirety, but I will draw your attention to the blue boxes. So down at the bottom, beginning in April, case managers will begin to assess members for Community First Choice if their continued stay review or if their new service plan starts in July. So if you are a member, expect to hear more about Community First Choice from your case manager beginning in April. And members will be authorized CFC services beginning on July 1st, 2025. And you'll see that in the upper blue box there. And services will be authorized on a rolling basis. So at a member's continued stay review would be when somebody would transition from waiver services over to the addition of CFC services if that meets their need. Okay, next slide, please. That is the conclusion of CFC, but I have the next presentation here too on the Children with Complex Health Needs waiver. This is, as Bonnie mentioned, this is a project that launches concurrently with CFC to ensure that members maintain access to the services that they need. So the Children with Complex Health Needs waiver will simplify access to children's waivers and expand access to valuable services. It will also prevent children from losing eligibility with the launch of CFC. Next slide, please. So the CWCHN waiver, it merges the Children with Life-Limiting Illness waiver with the Children's Home and Community-Based Service waiver into the Children with Complex Health Needs waiver. I know it's a mouthful. CWCHN is what we're calling this waiver. All members who are currently on the CLLI or the CHCBS waiver will be eligible for this new combined waiver. This waiver will launch in conjunction with Community First Choice on July 1st, 2025. And members on CLLI will automatically move to this waiver on that date. Members who are on the CHCBS waiver will transition over to CWCHN over the course of the fiscal year at the time of their continued stay review. The services on this waiver are the services that are currently included on the CLLI waiver, including expressive therapy, massage therapy, respite, therapeutic life-limiting support, palliative and support care, counseling and bereavement services, and then we're also adding the wellness education benefit. And I just want to point out that if a member has the need for personal care, health maintenance, or homemaker, those services will be available to CFC. So a child who's on CHCBS would not be losing access to their existing health maintenance benefit. They would just now receive it through CFC. Next slide, please. A few updates on this priority project. So we are working with our legislative partners on a bill which grants us the statutory authority to merge these waivers. So House Bill 251003 is moving through our legislative process. It has been passed through the House unanimously, and we'll move on to the Senate in a few weeks. We have a waiver amendment that has been drafted to combine these two waivers. That is currently out for public notice. So if you would like to provide comments on that, please do so. Our regulation updates are going to be presented to the Medical Services Board on April 11th. We are still accepting feedback on those regulation updates. If you would like to provide some, please do so. And similar to CFC, we have a website that has a lot of information on this change, including fact sheets and comparison charts. So please hop over to that and access those materials if you would like to. And case manager training began today. Just about an hour ago, we hosted our first case manager training on this project. Next slide, please. I have a high-level overview of the addition on the tasks that need to be completed for this project to launch. Again, I will draw your focus to these blue boxes. So on July 1st, 2025, all CLLI waiver members will transition over to the CWCHN waiver. There's nothing that they would need to do. It's an automatic transition. Services will remain the same. And then beginning on that date, CHCBS members will begin to transition over at their continued stay review. Okay, I think that does it for both of these projects.
All right, thank you so much, Lana. We're gonna turn it over to Dr. Haley Gleason for now. Friends, we see the questions that you have put in the chat. The team is working on answering them. And then I just want to maybe create space. If we have time, I will probably go back and have people answer some questions live so we can give a little bit more of a detailed response, but certainly want to make sure that we create space to get through our content today. So keep those questions coming. They're really great. And again, we're going to work on providing you some quick written responses. And to the extent that we can answer them live, we'll do that as well. So Dr. Gleason, over to you.
Thank you so much, Bonnie. Hi, everyone. Good afternoon. As Bonnie said, my name is Haley Gleason. I am the Strategic Outcomes Division Director within the Office of Community Living. And today I'm excited to give you an update on several key projects. Sorry, this is about to be a mouthful, but we have our support intensity scale decommissioning, the interim support level assessment, which will be replacing the SIS, the Colorado Single Assessment, also called the CSA, and the Person-Centered Support Plan, or the PCSP. So lots of projects that are co-mingling here. As Bonnie mentioned at the very beginning, these very much are intertwined. And so I'm going to give an update on where we are with all of these different projects. Next slide, please. So just as a reminder to everybody, the support intensity scale, or the SIS-A, must decommission by June 30th, 2025. That tool, it can no longer be used in Colorado. And so we are required to find a replacement for the tool. Initially, our plan was to utilize the Colorado Single Assessment as the way in which we would be replacing the SIS. Given all of the demands that we have on our system right now, as you can tell, as we're going through all of these many important projects, we made the decision back in December to delay the implementation of the Colorado Single Assessment and Person-Centered Support Plan. We want to be sure that when we do launch both of those, that it's done really successfully and thoughtfully, and we have some more work to do before we're ready to roll that out. And so that meant that we needed to find a different path forward to be able to decommission the SIS. We do intend to utilize the Colorado Single Assessment and questions from that assessment tool to for our new interim support level assessment. And so this new tool has been in development. So we are actively working with a very engaged stakeholder group to determine the questions that are appropriate and match the SIS tool and can be used to replace the SIS. So the development of that new tool, the support level assessment, is underway now. We are, as I said, working with our a really active and engaged stakeholder group to review all of those questions, as well as conduct mock assessments as we prepare for a pilot of this new tool. So that pilot will launch April 1st and run through June 30th. When we get to July 1st, I wanted to remind everyone that we are intending to roll the new interim support level assessment out using a limited approach. It will only be used with newly enrolling members coming onto the HCBS DD and SLS waivers that have never received a SIS-A support level before. So it's a small population of individuals that will be utilizing the new interim support level assessment. For those who already had a SIS support level, that support level will be maintained. So that will continue for any member who, again, is not newly enrolling. And then also just a reminder that the support level review process that is already in place is going to be maintained. That will be used for our existing members and those new members that are coming on. So the only new process will be the launch of the interim support level assessment with newly enrolling members. Next slide, please. I wanted to talk a little bit more about the pilot, since that is coming up quickly here. We thought it was very important to pilot test this new assessment tool. And so are intending to begin that pilot on April 1st, again, running it through June 30th. The new interim support level assessment will be conducted by trained assessors in collaboration with the participant and any of their identified supports. The tool will be used outside of the CCM. So the goal of this is to not rely on the existing IT system. Obviously, there's a lot of other projects that are relying on the CCM, and we wanted to pull this out of the CCM and not be reliant on it. So instead, we will be using an electronic Microsoft Excel spreadsheet that will have the assessment questions and will be used as the tool for collecting those scores. Those new interim support level assessors will receive training and have office hour support by the department. We are beginning our live virtual training of these assessors in mid-March. So that's coming up quickly. We're really excited to get them trained on the new tool. We are requiring that each case management agency send a minimum of 2 participants, so 2 individuals that will be trained as assessors. And it is a requirement that all of those assessors receive the full training, so 6 hours of training, and that they pass a competency examination before they are eligible to become interim support level assessment assessor. Next slide, please. And we also want to provide a little more information about being a pilot participant. So who are we looking for to be part of this pilot? We are inviting adults with intellectual and developmental disabilities and their families and caregivers to participate in this exciting opportunity to really shape what this new tool will look like. We are obviously would have you participate in the new assessment and also provide us with feedback on the structure of that assessment and how things went during the assessment pilot. Individuals who are eligible to participate, again, are adults with IDD who have completed a SIS assessment within the past 6 months. So our goal here is to be able to compare the interim support level assessment results with the results of the SIS assessment. So we are asking that these pilot participants undergo both assessments. They don't have to happen at the same time, but again, within 6 months, they would have had their SIS assessment, and then they would participate in the pilot and complete the interim support level assessment. And knowing that this is asking of people's time, we are providing a $50 gift card as a thank you for helping us, conduct this important pilot and gather this information so that we can feel really confident when we roll out this new tool. Next slide, please. Briefly, I just wanted to also make note that we are moving through our rules related to the decommissioning of the SIS and the new interim support level assessment. You can see the dates for when we intend to go in front of the Medical Services Board here. And just wanted to make sure that everyone was aware that those, we just did our preview last week, but we have our initial readout on March 14th. So wanted to make sure that was on everyone's radar. Next slide, please. And lastly, just wanted to show a calendar for how we will be moving through. Again, we are over here on the left-hand side, confirming those items for the interim support level assessment and conducting mock interim support level assessments. Right now, that is underway as we speak. Next up, again, we'll be moving through our rules and then also kicking off the pilot. So that's really the next big effort in front of us is getting the pilot underway and moving our rules through MSB. And then our intent is to launch the interim support level assessment on July 1st. And that is all I have for the SIS decommissioning. And we'll hand it over to Candace to talk about the nurse assessor.
Good afternoon, everybody. My name is Candace Bailey. I'm the HCBS Division Director within the Office of Community Living. And I'm going to give you some updates on the nurse assessor, and then I will move into some updates on the resumption of prior authorization requests for long-term home health. So first and foremost, the nurse assessor program. This is going to streamline the way that members are actually assessed to receive their skilled care services. Currently, the system is pretty choppy in the fact that a member will have to potentially go to different agencies to actually be assessed for a variety of different services, from certified nursing assistant or CNA or PDN. They might have to go to different agencies and receive multiple assessments. With the nurse assessor, we are going to streamline things so that a member can receive all of the services in the assessment at one time and have the education about what they qualify for and the different avenues that they can actually receive those services. Next slide, please. So today I'm going to talk a little bit about the process itself and how it is going to work. So last time I gave you an overview of kind of what the goal is and what the nurse assessor program is going to be. And today I'm going to focus in a little bit more on the process itself. So, here you can see the flow a little bit. The member has an identified skilled need. So, assessment can be conducted. A referral is going to be made to the nurse assessor vendor. So this will be a third-party vendor that will be contracted. We are in the midst of working that out right now. There was a request for proposal. The evaluation has been completed, and we are now in the time period where it is going to be announced, and there's the protest period and all of the things. So we still have a little bit longer before we can announce who the vendor is going to be. But as far as the vendor itself, then the nurse assessor will actually reach out to the member directly or the family member to schedule the assessment. The referral can be made by the member themselves, family member, case manager, home health, a regional accountable entity, a hospital discharge planner, etc. The goal really is to make sure that a referral can come from anywhere. The idea is not to make it harder, it is to allow everybody to send things in. The nurse assessor will be required to accept the referral in a lot of different ways, so a lot of different avenues that they can come in. And then there'll be a contractual requirement to set up the assessment within a specified time frame. So a lot of the timelines and things will be very, very clearly outlined within the contract with the vendor. Next slide, please. And then, so once the nurse assessor, so it will be an actual nurse, contacts the member to set up the assessment, they will meet with the member either in person or virtually, but it will be face-to-face, so it will have to be a video call if it is not in person, and that could be the preference of the member themselves. Perhaps they are immunocompromised and try to limit the number of people that come into their home. The nurse will then use the newly developed skilled care acuity assessment to go through all of the different needs, and then they will send a recommendation of the number of hours that the assessment has determined the member needs to the member themselves, the case management agency, if there is one that's attached, and the home health agency, if also the member is receiving services already through the home health agency. The assessment itself is made of several different components, so it's not just one piece. There are a lot of different tools and a lot of different components to make sure that the entire gamut of the member's needs are assessed at once. From CNA, oh, go back, please. Thanks. From CNA to RN and health maintenance activities, and also private duty nursing. If there are not skilled needs identified, or if the member chooses to utilize health maintenance activity through consumer direction, then the nurse assessor will also actually complete the direct care calculator as well. Okay, now I'm ready for the next one. Thank you. So here's the timeline for the implementation. So as I mentioned, the request for proposals, the evaluation was conducted in January. We have stakeholder engagement. We actually had a meeting last week. It was very well attended, which was really exciting. All of that information, the slides and everything is posted there. We also have an implementation plan that is posted that walks through the timeline and the various scenarios of what ifs, so that you can see that we are planning for a variety of different options should we need them. That is also online. In March, we'll be going through our contract negotiations with the selected vendor. We'll continue our stakeholder engagement. April, fingers crossed, contract is fully executed. And then we can start designing all of the training that is going to be needed. In May, we can train the vendor on the assessment. We will continue into June to train stakeholders on the entire process, prepare the system, and then everything is scheduled to launch in July. Next slide, please. All right, so I'm going to move right into pediatric long-term home health PARs, prior authorization requests. The PAR process allows healthcare policy and financing to demonstrate our statewide surveillance and utilization review. The process has been paused for many years right now, and so we are working to implement this in a phased approach to help our providers understand what the requirements are, work with them on utilizing this system that they haven't had to use in a while, and just really, help a system get back into the process of the medical necessity reviews. Next slide, please. So here's a few updates for you all. So as you know, as I just stated, we're doing this in phases. So we're starting with our therapy services, PT, OT, and speech. So physical therapy, occupational therapy, and speech and language pathology. We have what we called a soft launch that started 2 weeks ago. Super exciting. And the soft launch means that it is the process of submitting the PARs is voluntary at this point in time. We are asking that every single therapy agency submit some PARs, and we're tracking how many they submit, really to help them get used to the process. We really want them to get used to the process and understand what are the documentation requirements, how do they look up a PAR, how do they look up a case in the system where they submit them, all of the things. Then starting no sooner than May 1st, because we have to wait for the maintenance of effort to be lifted, no sooner than May 1st, things will go live, which means all PARs will be required and there will be denials issued for anything that is not deemed medically necessary. This same go live period for nursing and CNA PARs will begin July 1st. This is to coincide with the launch of CFC so that members that perhaps their services are not actually medically necessary for, let's say, a certified nursing assistant, but they still have some personal care needs, they actually can just transition into CFC at that time. We are aligning their CSR for their waiver with when the requirement will be for the agency themselves to submit the PAR to ensure that there is that streamlined transition of services where it might be necessary. Just to give you guys an update on some provider outreach, we've been working very, very closely with all of the providers. Accenture has offered PAR submission trainings, so specific trainings on how to submit and how to use their system, benefit specific trainings. They're also holding or have held and will continue to hold open hours for questions about the real implementation process. It's like an office hours. We have been contacting the bigger providers, the ones with the largest caseload, and held individual meetings with each and every one of them to help them understand, answer questions, make sure everything's making sense. And we'll continue through that process. Again, we are also tracking the PARs that are being submitted by each agency. So we know if somebody has 300 members and they have not submitted a single PAR. And conducting outreach on that as well so that we can say, what's going on? How can we help you? What, is there more information that you need at this time? Next slide, please. And then it's really helpful, I think, to have it all lined up into one graph as far as the nurse assessor and the launching of the long-term home health PARs. So as you can see, the different colors there moving along the lines and where we are with all of the things really going live and being fully launched July 1st to coincide, as I said, with Community First Choice. And with that, I believe I am turning it over to Jill.
Great, thank you, Candace. Hi, everyone. My name is Jill Schnodorst. I'm the Compliance and Innovation Division Director in OCL, and I'm here to give you an update on our transition and diversion efforts. So as a reminder, these are the programs that we're working to implement to support people who are living in nursing facilities and would like to move to the community, and those that are already in the community, how we can support them to remain in the community if that's where they would like to live. As a reminder, this also aligns with our Department of Justice settlement agreement, which was signed in October of 2024. Next slide, please. So last time during this webinar, I gave you kind of a rundown of some of the bigger initiatives that we have going on related to this work. And so today I wanted to provide you an update on some of the pieces that continue to move around. So first, I wanted to let you all know that we have updated the at-risk timeline. So as a reminder, this is a program where we are using a data algorithm and risk score to identify people in the community that are most at risk for nursing facility admission. And then once those individuals are identified, reaching out to them, providing additional supports and housing supports as well. So we've set our first distribution list that will go out March 24th, 2025. And one of the things that we did to make this a little bit more palatable so we can really get used to the process is that we're going to send out a smaller list. So this first list will include about 200 individuals to really help us pilot the outreach and referral process. The list will go to case management agencies and the regional accountable entities, depending on whether or not the member receives home and community-based services. The next piece I want to update you on is environmental adaptations. So this is a fancy way of saying home modifications prior to nursing facility discharge. So this is a program that we're implementing through the Money Follows the Person grant, and we're working through the contracting process right now. So we're expecting that contract to have two phases. The first one will be implemented in March as soon as we can get that reviewed and signed. And that will begin providing home modifications prior to discharge or environmental adaptations on the Front Range area. This contractor will also have some time to start building their rural provider network and are expected to start serving the rural areas with environmental adaptations in August. The next piece is to align with some of the care and case management system changes that have been a common theme in this webinar. We're updating the timeline for some of the other Money Follows the Person supplemental services and have moved a few of those service implementations to May of 2025. One, for example, is the peer mentorship prior to discharge. Another timeline that we have updated is rapid reintegration. That program is really designed to help people as they're getting a level of care screening if they want to live in the community but need to go to a nursing facility for a short amount of time, to really provide that wraparound support to help them move back to the community. Given all of the changes that are going on now in July, we decided to shift this timeline to January 2026 to give the whole system a little bit more time to adjust to some of these other priority projects. And we're able to do this within the Department of Justice agreement as well. Luckily, that timeline was a little bit longer, so we extended it out to put a little less pressure on things. Next slide, please. So here's that overall timeline again with some of the adjustments. You can see that some of the initiatives like Group InReach, where we're talking to members at the facilities, have already begun, and then some of the others are in process or coming in the future. We're still on track for individual InReach starting in July, and then also presumptive eligibility for long-term services and supports in January 2026 as well. That is with our federal partners for review, and fingers crossed we'll stay on track. And I think I'm passing it to Haley next.
Hi again. Haley Gleason. I am here to give an update on the care and case management system. I am standing in for Amanda Lofgren today, so I wanted to provide a little bit of an update on where we are in terms of progress towards resolving some of the known issues that are within the system, as well as the enhancements that are needed for many of the projects that we just talked about. So as you can imagine, many of these projects require updates and changes to the system for the case managers to be able to utilize that system for these new programs. And so we have both of those happening simultaneously. Next slide, please. So I wanted to give a little preview on our new CCM system stabilization and enhancements dashboard. This is just a snapshot of what the dashboard looks like for those of you who have not seen it. And this is a new tool that is being made public. So this is on our website. You can see the link. I think it's in the chat, or it will be soon, so that you can go directly to the dashboard and click around and check it out. You know, the goal of this tool is to be able to give insight and information to our stakeholders about our progress towards both resolving known issues as well as moving through those enhancements for the key projects. So you can see, I'm sorry that the font is a little bit small, but the top 3 items listed on the dashboard are really focused on categories of known issues that we are continuing to resolve within the system. So those top 3, obviously, key priorities for the department to make sure that we get these resolved very quickly. So just to walk you through the dashboard, you can see that it identifies who's responsible for resolving these issues, the total number of features. So each one of these is a category of items that we are working through. And so that total features tells you how many items we actually have within each of those categories. And then the percent complete. So how far along are we in resolving these issues? And then you can see a status on there so that you'll know, what red, green, yellow, how are we doing in terms of meeting those specific system update timelines. And then the finish date is overall for these system enhancements or system fixes. When do we anticipate that those, or our goal for those to be resolved? So again, those first three are really around the known issues categories for the CCM system. And then when you move lower down, you can see starting with community first choice, and they all have a hyperlink. So you can click on those and go directly to the pages, learn more about each of those initiatives. But those are really our priority projects, many of which we're talking about here, and the system changes that are needed in order for us to be able to launch those projects. And so there's a brief objective to describe what it is that is needed for that particular project related to systems. Again, the responsible contractor, the number of features, so the number of items within for each category or for each project that we are moving through. So the number of enhancements that we're trying to push through within the system, the percent complete, and then the status and finish date. I did want to note that the status is related to the systems component of the project. So if you do see something that says potentially delayed, that likely does not indicate that the entire project is delayed, but there may be some feature that is delayed in terms of when we had anticipated that it would be launched. So just to clarify what that means, this is really focused on the system component and the system needs for each of these projects. I also wanted to just note that this dashboard is updated on a bi-weekly basis. So every other Tuesday, you can jump in there and take a look, and it will be updated with new information. And we also wanted to note that this is the first iteration. So this is our sort of first attempt at providing this information in a more concise way for the public so that you all can get a sense of how things are moving along and the status of things. So you may see some updates and changes to this as we move forward. And are open to hearing your feedback on how you think, whether you think this meets your needs. We're just working to get that information pushed out more publicly. So wanted to make sure you were aware that this is available. Next slide, please. And then this just gives some updates on our timeline related to the care and case management system. We're really right here in that green box. We are really working to push out pre-scheduled releases that are addressing known issues and data quality improvements and reporting issues. So those are some of the ongoing known issues that we have and we're continuing to address in these monthly releases, as well as those enhancements. So the enhancements that will support those upcoming new projects. So we are continuing to work through that, and you'll see each month there are releases that will move us closer to that July 1st date of launching a lot of these initiatives. Next slide, please. And I am going to hand it back over to Bonnie, who is going to close us out.
Great. Thank you, Haley, and everyone who came before. I am going to round us out with just giving you an overarching view of our priority project implementation timeline, and then facilitate some live discussion around some of the questions that you all asked, just so that my team can provide a little bit more detailed responses. So if we can go to the next slide, please. So this gives you just a high level overarching timeline around what are the tasks that we have to do between now and July 1st, when many of these priority projects are going to be implemented. And you can see for the February, May timeline, we are squarely in the training rule regulation sort of presentation to MSB component of our implementation. You can see that as we move forward, we are hoping to award that nurse assessor contract in the spring. I know people have a lot of questions about that, and when we're in the RFP stage, we just have to be a little bit more quiet. And before that, looking to launch our initiatives. I think what's really important and that we didn't talk about today, and maybe some hard lessons learned over the last year and a half, is it's really important that with any launch of any initiative for us to anticipate that it won't go entirely as expected, even with really well planning and training and coordination. So while we have scaled back our initiatives really significantly and pivoted to what are the essential components of this work that we have to move forward with? How do we do this in the least administratively burdensome way possible? And certainly making sure that we have fidelity to high quality outcomes for our members. We need to have a safety net too, right? We need to have a plan B. We need to have an overarching management and escalation process so that post-implementation, we can see really early on, what are the issues that maybe are bubbling up from the launch. And so I want to also say that you have my commitment that our work doesn't stop July 1. We're like, hey, launch those, we're good. It really is that I think that the really heavy work happens post July 1st, where we'll be looking at making sure implementation went as expected, and maybe where there are some bumps that we catch those early and often, and make sure that we very quickly put our arms around any issues that maybe potentially might bubble up, so we can address them in ways that hopefully don't impact members, providers, families, advocacy agencies. If we can go to the next slide, please. I want to also highlight for you all that we have created a priority project webpage. So if you are interested in sort of diving deep on any of these priority projects, we have done our best to make that easy for you. Thank you, Max, for putting it in the chat. And giving people the opportunity to look at these more in depth, and also get links to engagement around each of these initiatives should you want to participate in any of this work more deeply. Again, this particular webinar is intended to give just a high-level overview on the status of our work and to cohesively bring it all together. So as interested members in our community, you can see how our work is moving along and sort of our current status around it. If we can go to the next slide, please. Also want to highlight for you that we have ongoing engagement opportunities. So if you haven't signed up for our OCL Digest, I would ask that you do that. We work really hard to make sure that we have ongoing written updates around our work. So in addition to these webinars that we've committed to doing, we work hard to also make sure that we're sending out written communication. We also have a stakeholder engagement calendar. Again, if you want to dive deeper into any of these engagement opportunities, your voice, perspective, and insight is very important in this work. And then provided some key links for you all as well. Thank you, Max, for dropping them to the Community First Choice Council. We are providing, in addition to this webinar, regular engagement and updates at the Children's Disability Advisory Committee. And then we have our long-term home health stakeholder engagement work that is really specific to the prior authorization resumption and our efforts around that. If we can go to the next slide, please. All right, so I'm going to go back to see our spreadsheet. We've been really working hard to respond quickly to your questions in a meaningful way, and want to maybe ask live a few questions here. And so there was a lot of questions. I'm going to start around the interim support level assessment, and wondering maybe Lori Thompson, who is my manager overseeing this work directly, if you'd be willing to hop on and help people understand, like, when will stakeholders be able to participate in the mock interim support level assessments? You state that they're going on. Are they just in-house? If you can speak to sort of our mock assessments and what that process has been. And also, do you foresee everyone who is enrolled in the DD and SLS waiver getting this interim support level assessment over a period of time? So can you speak to like how much of a pivot this is and for who? Maybe. I think Lori is trying to get on here. I apologize, folks, for having to wait here. I see her on, but Lori, we don't hear you if you're trying to talk. So I'm gonna try. Oh, there
Sorry,
you are.
Bonnie. I was not on as a panelist because Haley was presenting the information. But so to speak to the questions that were asked relative to the mock assessments that Jude asked about, we've conducted a couple of just in-house mock assessments to just test it out, experience it internally. And then we do plan to conduct mock assessments with stakeholders during our February stakeholder meeting. And that is just really an experiential kind of exercise to see how it looks and feels with this assessment. And then relative to the stakeholder group, this has been a group that has been working on the Colorado Single Assessment for many years. These folks are original members who worked with the vendor to develop the Colorado Single Assessment. And so it's this same group of folks, plus the people that worked on the CIS support level working session. And so it's that combination of people who have a vast array of experience in this work that we are doing the mock assessments with. We are going through the rules promulgation process right now. And once we get through the pilot, we will be posting the actual assessment online for folks to see before we implement it. Additionally, I wanted to mention that we are looking to recruit folks that are interested in participating in the pilot, members and their support respondents. And we will be sending out materials through the case management agencies, and we're asking for partner agencies, advocacy organizations, and such to help us to get the word out to people who are interested in participating in the pilot. And similarly, we are recruiting ISLA assessors, interim support level assessment assessors, through the case management agencies, and are providing training for those folks as well.
Great. Thank you so much for that, Lori. I think that is helpful. That was sort of our big pivot for implementation or decommissioning of the supports intensity scale. And of course, our goal there was to really minimize the impact on the case management agencies. And this was certainly a far more palatable option than moving forward with our brand new assessments, both in terms of the level of training required and the number of people that would be impacted. So I think we are confident at this point that this is a really thoughtful pivot that will support certainly our members, but also our case management agencies. Lana, I'm wondering if I can pull you back up next. There was a lot of questions around when CFC is live, the transition from waiver services to state plan services. I'm wondering if you can speak to our plan for when people will transition. Like, there's a lot of concern that everything will happen all at July 1st, and like, what impact will that have on our system? And then also concern around potential loss of services as people are moving from HCBS services to state plan. And can you speak to just a little bit more of the process piece around that so people can get their heads around it?
Yes, absolutely. So there will be no loss of services. I would say that that's the headline. The transition will be smooth for members as they transition from waiver services to community first choice. But what it will look like for an individual is as a member is coming up for their continued stay review and their new service plan, their new certification period is beginning, they will work with their case manager to be assessed for the long-term care services that they need to remain in the community. When the case manager is doing that assessment, they will talk to them about what services are available under Community First Choice, what services are available under a waiver, and then authorize services concurrently, regardless of how they're approved, which federal authority they're approved under. So from a member perspective, the service plan will be a kind of cohesive plan of all available services. If a member transitions a little bit later in the year, so say that a member is transitioning in December for the new certification period, same process will happen where a case manager begins those conversations a few months ahead of time with the member to talk to them about the new service packages, the new delivery options that might be available, and then transition that member on to the expanded services when their service plan begins. There really won't be any impact or loss of services for members because they will remain on their waiver services until they transition over into CFC. So those, for example, personal care will remain a waiver benefit for an entire 12 months as we transition everybody over into this new process where they can have CFC and waivers concurrently. Did I miss one in there, Bonnie?
No,
Did that
I think
answer
that
all the
was
questions?
great. I think the other thing that I wanted to highlight, I think it was our first question out the gate is, you know, what happens if federal funding for CFC changes? And I'm going to take a stab at answering this question, but certainly ask that you chime in and add any color to my outline. You know, we are implementing CFC with the current enhanced match, and an implementation of CFC is contingent upon that, right? It is contingent on us being able to have that enhanced 6% match. And so, you know, we have some contingency plans sort of outlined. It's not as though it's not something we also haven't considered should that enhanced match be rolled back. But I think the commitment that you can hear from us is in the event that federal funding for Community First Choice changes, we will communicate transparently with you all around that and work thoughtfully around next steps. But in the meantime, I think it's important for us to move forward with the implementation as planned. And make sure that, you know, we implement our statutory requirements around CFC. So Lana, is there anything that I missed there?
I think that you covered it, Bonnie. I think the only thing I would add is that because we are transitioning into CFC over the course of 12 months, that we really do have some time to get our footing and to understand what things are looking like from a federal perspective to make sure that we are planning, to make sure that no member has any loss of service. So I'm very confident in the fact that the way that we're rolling out CFC is at a pace in which we could pivot should that be required.
Yeah, I think that is great. Thank you so much. I am going to, if it's all right, actually, while I have you here, I think there's a lot of questions from providers around licensing requirements, specifically for enhanced homemaker services. I think people understand that there is a licensing requirement for the personal care and skilled care services, but can you speak to homemaker specifically and what the licensing requirements are for that service?
Yes, I can. So homemaker requirements, homemaker providers aren't going to be required to get a license under the change because if somebody's providing homemaker services, they don't necessarily need a Class A or a Class B license. I might have to phone a friend here, but I believe that there is a certification required for that. And I'm going to wait to make sure that I don't say that incorrectly. But for the provision of only personal care, you would not have to continue with the PASA kind of licensure process that's outlined in that operational memo. If a PASA does provide both personal care and homemaker services, it would be important that they pursued licensure to make sure that they are able to continue to provide personal care under the community first choice benefit. And I did just get confirmation about no changes there for homemaker providers.
Thank you for that, Lana. I really appreciate it. I'm wondering if I can get Candace to come back up. There was a lot of really great questions around the nurse assessor in particular. And I'm wondering, Candace, if you can speak to how are we going to train that new vendor? What does training look like around the nurse assessor? I think, people have a lot of questions around making sure that this process that's really designed to make sure that people have access and understanding to holistically what they're eligible for is done in a way that the person really understands it. And then because I like to ask 2 questions at one time, but you can come back to me if you forget. If you could also speak to like the calculator component of that, I think that's where I'm seeing a lot of questions there too. So I think a live answer might help here.
Sure. Thanks so much, Bonnie. So as far as training is going to be a big deal and something that we are going to make sure that we start as early as possible. We want to provide training both for the vendor themselves, but also we want to provide training for our community and the stakeholders, our case managers, our RAs, everybody else that's going to be involved in the process to understand how it's going to work. The vendor will be required to go through training, do some mock assessments, make sure that we are in agreement with how things are going. There's also really specific training that was created by the vendor who made the new acuity tool, the valid and reliable tool. So there's really specific training around that the vendor also created that will be provided to the vendor as well to make sure that they understand the acuity tool, how it works, and that they are conducting it appropriately. In addition, one of the other things that we've been asked, and I didn't see the question today, but I think it's worth mentioning, is we've been asked if the vendor will have specific training or experience in working with members of a variety of needs. So for example, will there be a person that can assess a child with complex health needs? Will there be a nurse that can assess an individual with an intellectual and developmental disability? So those are actually going to be requirements as part of our contract for the vendor, that they have staff and personnel that have experience in conducting assessments and working with individuals with a variety of needs as well. So wanted to mention that because that has come up and I think it's important and it's a good piece of information for you all to have. Around the direct care calculator, so the vendor will also have training on how that works. And the idea is that if a member is either seeking health maintenance activities, so consumer direction, or actually doesn't have identified skilled care needs, but they still have needs that are really important, but perhaps they're personal care, the vendor will conduct the direct care calculator utilizing the assessment information and the conversation with a member to create the hours as well. And then that information will be shared with the case management agency. And that the vendor will be trained specifically on all of the different benefits and also the direct care calculator and all of the different things. Bonnie, did I get both of your questions? I think Bonnie might be on mute.
I am on mute. I said some really great things that you all just missed. I think that is really a great explanation. Thank you, Candace, for diving a little bit deeper there. Can you speak to a little bit more? I see maybe some confusion around the timeline for rollout of the nurse assessor and when people can expect to have access to that nurse assessor in relation to sort of their holistic benefits.
Sure. So the process will begin July 1st. That's when assessments are going to begin. And what we're going to do, and it also coincides with the resumption of the long-term home health PARS, specifically nursing and CNA services, certified nursing assistant. And so the idea is that the nurse assessor will conduct their assessment at the same time that the prior authorization is going to be required. And the reason for this is this nurse is going to be able to holistically assess the individual and provide them the education and support them in deciding what avenue and what pathway they would like to receive their services, because there's more than just one. And so they will be able to help them once the PAR needs to be submitted again, with understanding what their options are for the services so that an appropriate PAR can be submitted. In addition, for individuals that are also eligible for a waiver or may become eligible for a waiver, those that are already on a waiver, they actually have their continued stay review, their CSR. And so we are going to work with the home health agency and the case management agency to have the submission of the PAR, and then, yeah, obviously the referral to the nurse assessor align with their CSR. So all of that can happen at the same time. So there is no difficulty in transitioning from one to the other should a transition need to occur. So home health agencies will have the information for the members they serve on what their CSR dates are for the member so that they can align their PAR submission with that. And thus the nurse assessor will go out and conduct their assessment and really holistically help the member determine where and how they want to get those skilled care needs met. Hopefully that helps with that.
Yeah, that does. Thank you so much, Candace. I really appreciate it. I'm wondering if I can't pull Lana back up here. I just see a lot of CSC questions still coming in. And I'm wondering if we can't answer a few more of those live, just in terms of the transition piece. Thank you, Lana. So again, I think that there is a lot of, I think there's provider questions and then there's member questions. So maybe we can start with the provider side of the shop. You spoke to last time the licensing requirements for providers under CFC, but can you maybe speak to, and you may have to phone a friend, like how the billing processes might look different? Do they have to have specialty codes? Like, what should they be prepared for from a provider side of the shop?
Yeah, thank you for that. That's a great question. So from the billing perspective, we're trying to make this as easy for providers as possible. So if a provider, for example, an EBD personal care provider, currently licensed, ready to provide services under that specialty code, that specialty code would work under CFC as well. So a provider will not need to go in and do any new re-enrollment in their provider profile or add any specialty codes. What will change is the way that a provider bills a specific procedure code. So for example, EBD personal care has a U1 modifier. Under CFC, that will now be a U2 modifier. So those waiver specific modifier codes will be replaced with a CFC code once the member is on CFC.
It's super helpful, Lana. Thank you so much. I think the other thing where I have heard some confusion and see some confusion around is the web benefits. Like, what is the purpose of that? I think some people have received it and they're like, okay, I don't even know why I'm getting this. And I had this thought of, we really need to speak more directly around why we implemented that and why it is so important as we move forward. So can you speak to the web and benefit, why we did it, and why it's so important that it continues?
Yes, absolutely. Do we have all day? I'll talk about the web all day. So the wellness education benefit, that is a new benefit that we first rolled out under the CHCBS waiver. It has been in that waiver for, I think, about 10 months. When we initially rolled it out, it was to ensure that members maintained their waiver eligibility as we removed case management as a service and moved it more to an administrative function. So the benefit's really twofold. It provides educational materials to members. It is a newsletter or a kind of paper benefit that is physically mailed to a member. And it has health and wellness tips. For example, if it's an older adult receiving the benefit, there might be something around fall prevention and taking vitamins. If it is a child receiving the benefit, there might be some tips and tricks around how to make new friends at school. Or if it's a young adult, it might be how to enter the workforce, if that's something that the individual is interested in. So this comes to a member with some great wellness and kind of health tips. And then also it can help a member maintain waiver eligibility. So as case management, for example, transitioned out of CHCBS, this benefit made sure that all of those kiddos were receiving a waiver service every month, which is a federal requirement for maintaining waiver eligibility. As we move into the new setup under Community First Choice, this benefit is being rolled out to all members on a waiver. So all folks should begin to receive this benefit in the next few months. One thing that will be helpful is it will help members maintain waiver eligibility if they choose to. So under Community First Choice, a lot of those really frequently accessed benefits like personal care and homemaker are now accessed through the state plan. The wellness education benefit will be a monthly waiver service that a member can get useful information out of and also help them maintain waiver eligibility if they would like to remain on a waiver, or if a member needs that waiver to be eligible for Medicaid as a whole because it has that higher income threshold.
That is super helpful. Again, I just want to highlight for folks, it is necessary to ensure that people maintain Medicaid eligibility with our transition from HCBS waivers to the implementation of CFC. And so in a world where we are prioritizing, all of this work, it may seem more nominal, like why would we keep this? Why would we have this? And again, it is about ensuring that folks have eligibility. So to the extent that you are conduits to your community and you hear questions like those being asked, I would be deeply appreciative if you'd help share the why. And we will certainly do that on our end as well. Lana, I am going to wrap up with you. See, we started with you. I'm going to wrap up with you. I think the other question I see a theme around CFC is maybe if you can speak to how will CFC look different for adults versus kids? I think people are maybe struggling a little bit to understand the differences in the Community First Choice benefits for those populations, or are there differences?
Yeah, that's a great question. So one of the really great things about Community First Choice is it no longer targets adults versus children, or a member with an intellectual or developmental disability versus somebody with a physical disability. If a service is available under CFC, it is available to any member who qualifies for the service that has an assessed need. So personal care will be available to children in the same way that it's available to adults. So some of those kind of historical differences, like a family member or a parent not being able to provide personal care to their child, those will be removed under CFC. And a guardian can provide personal care similar to how they would provide it to an adult. We are also expanding access to our CDOS program and our IHSS program, meaning that more children will have access to health maintenance activities, more families will have access to the way that to consumer direction, more families will be able to get paid for providing services to their loved ones. So CFC levels the playing field between children and adults and between people with different disability types to ensure that everybody gets the care that they need regardless of who they are.
Fantastic. Thank you so much, Lana. And with, I think I went from having what I felt like was a lot of time, and now I feel like we are a little bit over time. I think we had planned to wrap up by 1:50 to give folks in the virtual space a little bit of time to transition from what I know are back-to-back meetings or responsibilities for many people. I want to thank my colleagues for their presentations today, but certainly thank all of you for your engagement and fantastic questions. I have an entire team of people behind the scenes working to be responsive to each and every single one of your questions. Please know that if we didn't get to a written response for you today, we are reviewing these, we are using them to inform our FAQs, and to inform any guidance that we're issuing as we move forward. So we really appreciate you highlighting where you might need some additional clarity. I want to remind you our commitment is to continue to provide these priority project updates every other month. This is in addition to the policy specific engagement and our written communication around this work. So we won't see you in March, but we will see you in April for those of you that are interested in an update then. Again, thank you so much for spending your afternoon with us, and we are deeply appreciative of your collaboration and look forward to your continued engagement as we work to move this important work forward. So thank you, and have a good week.